Hello, my name is Micah Pengitore. I'm a physical therapist assistant here at Prairie Rehab in Sioux Falls, South Dakota. In this tutorial, we will be going over self-MLD for the left lower extremity. This tutorial is to help increase your technique for your home program that has already been developed by your physical therapy lymphedema specialist. Before we begin the demonstration, we will be reviewing the lymphatic draining pathway, hand placement, hand pressure, stroke pace, and lymphatic node sites. Draining pathway. Draining pathway all leads to the heart from when it comes to all lymphedema, and then it is then urinated. Second, hand placement and direction of the stroke. When it comes to hand placement, I'm going to demonstrate on my arm up here, but this all applies for the skin that you're keeping in contact during the stroke, even for the lower extremity that you're working on. So, hand placement. You do not want your palm or your thumb involved. You want just the fingers involved. You can use a little lotion when it comes to this too, so when you do put it on your skin, or you spread it on your skin, you keep that tackiness involved, so you can get that skin stretch, which I'm about to show you talking about. So, fingers go onto here, thumb and palm are not involved. You have that skin stretch and a perpendicular stretch here. You see the skin stretching? Next, hand pressure. We do not want too much pressure applied. As you can see, red marks do occur if you are pushing too hard. The pressure should be light, kind of mild. It should not be very strong pressure when you're on there. Next, we want to be able to give a directional and purposeful stroke and position of this. So, we're going to do stroke and then a purposeful directional flow of the fluid. Next, we'll talk about pace. This should be a 1, 2, 3 pace. Should be 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. That should be the count that you go at. Last, we're going to talk about the lymphatic node sites. You have the ones in your cervical, armpits, and groin. In today's session, we will not be stimulating the left node site. That is the site that is the involved site. You do not stimulate that involved site. All right, we begin our demonstration now. First, before we start, we do our deep breathing. Breathing in, breathing out, and we do that 3 times to start out with. Next, we do our stimulations. Cross your hands. Find this area here. I'm going to take this off here. We find that area right above the clavicle here. There should be a little dip. Put our hands there. And we do 10 pumps here. Should be mild, moderate pressure. It should not be very hard. And still that 1, 2, 3, 1, 2, 3, 1, 2, 3. And then you do the cervical, doing 10 strokes here. 1, 2, 3, 1, 2, 3. 10 on this side. 1, 2, 3, 1, 2, 3, 1, 2, 3. Then we do the armpits. 10 here, 10 here. Not doing this side, but stimulating here on the right side, right along the panty line, or as you can see, underwear line. 10 strokes here. Stimulate this node. Okay, now that we've stimulated all of our nodes here, now we want to give a pathway for the lymphedema fluid to go. So we go up, away. This would be 7 strokes going up this way. 7 strokes here. Remember that pace and the contact. 1, 2, 1, 2, 3, and then coming across. Remember, this is all on skin. And you can reapply a lotion as needed to keep your tackiness. 5 to 7 strokes this way. Next, we will begin clearing the pathway now. When you do this, I have a chair here. You can do it whatever is most comfortable for you. You can have a chair, you can do it with your leg going down, coming through, whatever is most comfortable for you, whatever works. Next, we will first start proximal, working distal, and then working our way back up again. You can do one hand at a time, and then you can switch hands actually and make sure whatever you have that best hand movement that you can get. Doing that 1, 2, 3, 1, 2, 3, 1, 2, 3, and then come to the other side. 1, 2, 3, 5 to 7 per side strokes, the entire length. So 5 to 7, 5 to 7. You can do doubles if you feel good about it. You can do doubles on the bottom here because you want to make sure you encompass all sides. You can do one hand if you feel more comfortable with one hand. One hand underneath here if you feel more comfortable with one hand underneath. Next, we want to make sure that we stimulate, or as in activate, this medial portion right here, which is a very important site. Going down, directional. Five to 7 here. Then doing the lower leg, you can do doubles, or you can do one, whatever's most comfortable for you. And then make sure you get the calf, making sure we get all sides of the lower leg. 5 to 7 strokes. Next, we want to make sure we do the bottom of we do the whole foot as well. That is included. So we do each individual toe. If there's swelling in your toes, with a circle type of positioning. Doing each individual toe, circles going upward, still the 1, 2, 3. And then doing the foot, top of the foot. You don't need to do the bottom of the foot. Same thing, 1, 2, 3, 1, 2, 3. And you do the ankle too as well, don't forget the ankle. 7 strokes there. You can do one side if you feel more comfortable with one side. Do one side of this side, or both, like I said. Now that you've stimulated, opened up the whole traffic way all the way up, now we work our way all the way up the chain. So working up from the bottom, doing the ankle, coming up, working our way all the way up. This is considered one stroke. Coming through again. Don't forget that calf. So you do 5 to 7 strokes all the way up the leg. All right, so that's that portion. Now we open, make sure we have our pathways again, so the fluid that we've cleared through, that's the place to go. Stand up for this portion, going across the body to the opposite side, 5 to 7 strokes. Five to 7 strokes. 5 to 7 strokes this way, 5 to 7 strokes this way, and then you end on your diaphragmatic breathing. Alright guys, For any questions, please contact your lymphedema specialist at 605-334-5630 or visit our website at prayerrehab.com. Thank you for watching.